And it goes a little something like.
So it's me, student nurse Kristel, and we will going to discuss the pharmacokinetics and pharmacodynamics. So let's start with the pharmacokinetics. Pharmacokinetics, it is the movement of the drug across the body membranes to react its target organ to achieve the drug action. First, of course, we need to administer the drug in our body. It's either through our mouth, skin, or direct to the bloodstream. Now, I want to talk about what happened next to the drug. Once the drug is inside your body, how the drugs move around. In studying pharmacokinetics, we can highlight the four main processes: the absorption, distribution, metabolism, and excretion. Let's start with the absorption. Absorption is the movement of the drug from the site of administration into the bloodstream. If the drug administered topically, it might move through the skin or in our mucous membrane to reach the bloodstream. Next, if the drug is administered through orally or using our mouth, it must be absorbed through the lining of our stomach or in our intestine. Some drugs can pass through cells by either passive or active transport. In passive transport, there is no ATP required, while in the active transport, there is ATP required. In describing this process, it is also appropriate to review the terminology bioavailability, and it is the proportion of a drug that is successfully absorbed into systemic circulation. After the drug was absorbed, it is now time to distribute. Distribution is the way of drug move through the bloodstream after being absorbed. There are so many factors that influence it, like the way how the drug interacts with the components of blood, such as our plasma protein. Take note that if the drug binds too tight to these proteins, it will not able to react its target cells. After the distribution, the drug will now metabolize. Metabolism is the reaction that inactivates the drug. For example, if the drug is administered through oral, it will be absorbed through our intestinal wall. And for the reason, the part of circulatory system, it enters the collection of blood vessels or what we call the hepatic portal system. These carry blood directly to the liver where they will be metabolized, and this is what we call our first pass effect. After the drug was metabolized, it is now time to excrete. Excretion is the drug or its remnants will finally exit the body. It is typically done by exhalation, sweating, but most of the time it is through urination and defecation. After it, what exactly does the drug do to our body and how it is produced by cellular response? The study of this process is called pharmacodynamics. And in this topic, we will going to review the common terms or the common terminologies. Basically, first, pharmacokinetic, it is the study of how our body reacts to drugs. While pharmacodynamic, it is the study of how a drug affects of our body. Let's start with the effects of drugs. First, we have the dose, and it is amount of medication that is given to our patient. We have 7 types of dose. First, we have the loading dose, and it is the initial high dose that is given to our patient to achieve the minimum effect. Second, the minimum dose. From the word itself, minimum, it is a minimum amount that will cause therapeutic effect. Third, the therapeutic dose, the amount of drug that will cause therapeutic effect. Fourth, the maximum dose, the largest amount of drug without producing any toxicity in the body. Fifth, the toxic dose, or the amount of dose that will produce harmful side effects or it can cause poison to our patient. Sixth, the lethal dose, or the dose that can cause death. Lastly, the maintenance dose, drug that required to keep drug blood level or to maintain the desired effect. Next, for the drug concentration, we have the onset of action, peak of action, and duration of action. Let's start with the onset of action. It is the time to take the reach of MEC. Peak of action, it is the drug reaches its highest blood plasma or plasma concentration. Duration of action, it is the length of time the drug has effect in our body. Next, we have the agonist and antagonist. Let's start with the agonist. It is a drug that produces response to our body, while the antagonist, it is a drug that blocks the response in our body. And lastly, of course, we have also the non-specific and non-selective drug effects. For the non-specific, it is a drug that affects various sites. And for the non-selective, it is a drug that acts on different receptors. So that's all for the discussion, and hopefully you have learned something from me, and thank you for watching. Bye!